Welcome to Concussion Talk Podcast. My name is Nick Mercer. I write Concussion Talk, www.concussiontalk.com. This is episode number 14, and in it I'll be talking to Kit Darling. Kit is a physiotherapist on the Acquired Brain Injury Rehab team at Toronto Rehab Institute, part of Toronto's University Health Network. We talk about the work she does for her brain injury patients. Okay, I'm on the phone now with Kit Darling of Toronto Rehab Institute, and I'll get Kit to introduce herself and tell you about the work she does. So, Kit, please.
Hi, Nick. My name is Kit Darling. I'm a physiotherapist at Toronto Rehab Institute. I work in the Acquired Brain Injury Inpatient Rehab unit, and I did my physiotherapy schooling at U of T, and I graduated in 2009.
Great. Okay, so you graduated in 2009. So how big a part of you graduated your physiotherapy degree in 2009, right?
Yep.
Okay. How big a part of that degree was brain injury, concussion treatment? Was that topic covered a lot, or just more? Is it just in general? Was it just in a general sense?
Well, in physiotherapy, it's kind of divided into three main areas. So you have your musculoskeletal physiotherapist, cardio rest, and then neuro. So within neuro, we learned about brain injury, stroke, but a whole bunch of other neurological diagnoses like Parkinson's disease and spinal cord injury and whatnot. So concussion would have been a small portion of that as well.
Okay. Well, thank you. So, you mentioned you work in Toronto Rehab, but for people who don't know, could you talk a bit more about Toronto Rehab Hospital, Rehab Institute, and the UHN network, and how many PTs are there? How long have you worked there?
Okay. Well, I did a little bit of research for you, and I found out that Toronto Rehab was founded in 1922, and it was the first freestanding rehab facility in North America.
Oh, there you go. That's impressive.
Yeah, so initially it was open to cater to Canadian soldiers that were injured in World War I. But I'm not much of a historian, so fast forward to now. Toronto Rehab consists of about 4 main sites, and they all cater to different patient populations. So there's the Lyndhurst Centre, which caters to spinal cord injury patients. There's the Bickle Centre, which does complex continuing care. There's the Rumsey Centre, which has cardiac rehab as well as outpatient stroke and brain injury. And then the University Centre, which is where I work. It has inpatient brain injury, stroke, geriatrics, musculoskeletal, inpatient and outpatient facilities, as well as research facilities.
So the University Centre, is that on U of T campus, or is it just right downtown on University Avenue?
It's downtown on University Ave, which some people refer to as like Hospital Row, because there are about 4 hospitals on that street.
Yes. So, and that's part of the University Health Network in Toronto. So it's about 4 or 5 hospitals.
Yes, I believe it's 4 hospitals. There's the Princess Margaret Cancer Centre.
Yeah.
There's the acute care hospitals of Toronto Western and Toronto General, and then Toronto Rehab is the rehabilitation aspect, I guess, of the University Health Network.
Okay, wow. So how long have you worked at the University Centre in Toronto Rehab?
Well, I started as a casual therapist in 2009, just working in various programs across 3 of the sites.
Okay.
But I got my first contract in brain injury in 2010. I worked there for a couple of years before I decided to move to BC, and I took a job in concussion there for a couple of years.
Did you say BC or DC?
BC, Kelowna, BC.
Okay.
Yeah, so I've since moved back to Toronto and have been back at TRI in brain injury for about a year.
Okay, well, and you mentioned me before that you work in the neurocognitive stream now, and you previously worked in the neurophysical stream. So, could you tell people what those two streams are? And are there any other streams of ABI, acquired brain injury?
Good question. So at Toronto Rehab, the acquired brain injury inpatient program is divided into two streams. So the neurophysical stream would cater more to patients who have significant physical difficulties, such as weakness and inability to walk, things like that. And the patients on the neurocognitive stream typically have more cognitive impairments, so problems with their memory, problems with their attention, orientation, and things like that.
So you are you work in the inpatient hospital, which kind of answered one of my questions, which was how do they get to you? But they're in a hospital, so these inpatients, they come to you directly. Does Toronto Rehab have a hospital inpatient unit in the building, or is it? Do they come from? Are they just doing rehab there? Are they doing hospital there? Are they being treated there for hospital issues? Or are they there simply for rehab?
So typically, I would say the course after you get a brain injury, first you would be in an acute care hospital, where you're getting treated for your medical issues. So you'd have your surgery there, and you'd probably be a lot more unstable, have your lines and tubes and constant monitoring by doctors and nurses and things like that. Once you're more medically stable, then you get moved to a rehab hospital, and that's what Toronto Rehab is. So certainly the patients are sleeping there overnight, but they're medically stable and they don't have as high medical needs, I guess you could say.
Okay. When I was in my the acute care hospitals, when I was just after I had been injured, my mind is very hazy at this time, but I saw some physiotherapists who were just teaching me how to sit up, and so how is that part of the Just University Health Network, or is that part of the Toronto Rehab, your mandate?
So for sure, early on, you'll see physiotherapists in acute care as well, because it's important to get patients moving early on, even when they have their medical, when they're more medically unstable. But it's once they're in rehab that they're working about, an hour a day with physiotherapists, doing a lot more physical exercise.
Oh yeah, well, I remember that well. Sorry?
Is that?
Oh, sorry, I lost your audio there for a minute.
Oh, whoops.
Not for a minute, but for a few seconds. So when these patients come to you, they come to you directly from the hospital. But so do you get a doctor's report before you see any patient, or when you see a patient? Like you obviously do get a doctor's report. So when do they come to you? Before, during, or just after you've seen them once, or?
So typically we'll get like a discharge summary from the acute care hospital that will outline the medical care that they had when they were in the acute care hospital, and we would read through those and a few notes from the therapist in acute care just to see what their functional status is. We would read through those before seeing the patient for the first time in rehab.
Okay, so about how many patients do you think you see a year in this sense? Well, generally, I mean, I don't know if you can be allowed to tell the exact number, but...
That's a good question. I see my caseload is about 6 patients at a time, and they stay for about a month each. So that's 6 patients a month times 12 months is about 70 patients a year.
So wow. So do you see patients every day? Like the same patient will come for an hour a day every day? Or
exactly.
Okay.
Well, Monday through Friday, and then we have one day of weekend therapy, which is a little bit different.
Yes, it is.
And then the patients get to take a break on Sundays.
Great. So how many, would you say, how many repeat patients have you seen patients that you've seen before for a brain injury and seeing them again for a brain injury or even another. I guess you only see brain injury patients, but so how many repeat brain injury patients have you seen? Have you seen any?
Hopefully it doesn't happen too often. It's pretty rare that we would have a patient come back with a second brain injury. Hopefully we've done a good enough job to keep them safe and nothing happens again, but you never know. So, I think I've had maybe in my entire career, maybe 1 or 2 patients who were in rehab after sustaining a second brain injury.
Oh, I'm serious. Wow. Well, that's good. At least on 1 or 2, at least. I mean, it's not good, but it's better than more than that.
Yeah, for sure.
So, you say you read the doctor report before you see a patient, but are there is there anything that you as a physiotherapist want to know about a patient that you can ask him or her, or just watch him or her, and that you don't read on a doctor report, that you just see by observing? You just tell by observing. You learn, by observing.
Well, I think the most important thing that I want to know would be by asking them just what their goals are for their therapy and kind of what they like doing before, so that I can incorporate their interests into my treatment.
Well, this is kind of off script, I guess, but off the question script I sent you. But how important do you think having goals for the rehab is?
I think it's so important because I think it's so important because it can be difficult, I'm sure, as being stuck in a hospital and not doing your day-to-day real life. So if you have something achievable that you really want and you can work on day-to-day, I think that probably makes your time in rehab a lot more valuable and meaningful every day.
Yeah. So do you think these goals, because obviously brain injury patients have other issues as well, do these goals always come directly from their thoughts, or do they think they've had a bit of, not coaching, but help with defining their goals by doctors and other therapists? Or do you see that just later on as they progress?
We try to encourage all the patients to set their own goals, but some for sure might need a little bit more help than others. As you know, because I think you're going to ask me a question about, if patients know how physically impaired they are, if they know the cognitive issues they're having, and sometimes they don't, unfortunately. That's part of brain injury. So patients who can't really understand what their impairments are would definitely need a little bit more help setting goals.
That's a good segue, actually. My next question, which was, so do people often know themselves how much they've been psychologically or emotionally affected by their brain injury?
Yeah, I mean, sometimes they know, and sometimes, unfortunately, the area of the brain that kind of monitors how your brain is functioning is injured, and that's called insight. So if patients don't have insight, they can definitely have a harder time monitoring how they're doing and how they're feeling. In terms of the psychological and emotional impact, I think generally I find that the patients that I see are in good spirits. Maybe that's because physio is always fun, but I would guess it's more when they're in a really structured environment. There's a lot of focus on recovery, and it's probably more when they go home back to their real life that more psychological and emotional issues start to arise.
Thank you. So, as you know, every brain injury is really different, but are there any exercises that are like go-to exercises for you for a particular set of skills that patients need to develop, like physical skills, like exercises, or that you like, or do you think are very important to show certain things?
For sure. I mean, as you said, all patients are different, so they all need different exercises. But I like to pick exercises that reflect patients' interests. So, if they liked playing sports before, like golf or hockey, try to incorporate a golf club or a hockey stick or something like that into the exercise. For example, I had a patient whose girlfriend was away at school in England when he was in rehab. And he had this goal of picking her up from the airport with a bouquet of flowers. So instead of just doing kind of boring gait training exercises, we pretended we were at the airport, and he held a cone that was, it was the bouquet of flowers, and we practiced kind of walking through a busy hallway where we were mimicking busy people in the airport.
Actually, yeah, that's kind of similar to, not similar, I didn't have a girlfriend at the time, but similar to, like, when I was doing physiotherapy, my physiotherapist would incorporate a lot of just the general area, general St. John's, and general where I'm living, and my activities, I used to go flow, so I swam a lot, and they tried to get me when I was doing triathlon when I was injured, so they tried to get me on a bike and run, even though I'm very unstable still. I'm not unstable still, but I'm not running. Running, I can't really be stable, so they're trying to incorporate that too. Physiotherapists, or I guess, I don't know, known for incorporating the activities of the patient. So
it makes it a lot more fun and meaningful, right?
It does. Totally, yeah, it makes it more interesting too. Yeah. Mm-hmm. So
another thing I like to use is the Wii balance board for higher level patients.
Oh yeah, I've used that.
More enjoyable.
Can you just tell people what that is? I know that myself, but.
Oh, do you know the Nintendo Wii?
Yeah.
So they have this board that you can stand on, and you can do balance exercises on it. And there are games, for example, like a snowball fight, where you have to kind of shift your weight to avoid getting hit by a snowball and things like that. It's pretty fun.
Nice, yeah. See, it's actually, I had a Wii. I had the tennis rackets. Well, not tennis rackets, but the controller is or the racket. And I think I had the board but this one earlier on, like, not right after my injury, but ended up was very unstable on the balance board myself. But so going back to actually Toronto Rehab Institute, you said you're in the ABI program. So can you talk more about what the ABI program is, and how it works in Toronto Rehab?
Yeah, so the ABI program caters to individuals with acquired brain injury. So that would be a brain injury that you sustained after birth. It could be traumatic brain injury, such as, motor vehicle accidents, bike accidents, like such as yourself. It could be non-traumatic, so aneurysms, bleeds, things like that. There is a separate stroke program at Toronto Rehab, but occasionally we'll see stroke patients on the acquired brain injury unit. And the way that it works, as mentioned before, the patients will initially have an acute care hospital stay, and then once they're medically stable, they'll come for inpatient rehab. On my unit, which is sorry, my mind went blank for a second there. The neurocognitive unit, the patients typically stay for about a month, and they'll work with not just physiotherapists. They work with occupational therapists, speech therapists, social workers, nurses, doctors, rehab therapists, behavior therapists, etc., etc. So they'll work on a whole bunch of different areas, a whole bunch of different goals. They usually stay about 1 month, and then if they still need more therapy, we can refer them to the outpatient ABI unit, where they come, they live at home, but they come twice a week to continue working on their goals.
And the outpatient unit is in Toronto Rehab Institute itself, the same building?
Yeah, so there is one downtown at the University Centre, and then there's also the Rumsey Centre, which I talked about before, it's in another location, but it also has outpatient ABI and stroke programs.
I know my outpatient experience was also very good. But considering. So
was your outpatient? Sorry, what was your outpatient experience also at St. John's Hospital?
The Miller Center, which is the local rehab institute, the provincial rehab, well, not provincial, I guess, St. John's an area, and almost everyone who comes here for brain injury or has a brain injury goes to the Miller Center. I went did inpatient and outpatient there, same place, and many of the same physiotherapists.
Okay, that's nice for continuity of care.
Yeah. So actually, this kind of segues in this one. So from what you've seen a lot of brain injury patients, and you have a good bit of experience with them. So, what do you think do you have any idea of how you can predict how well someone do you think will do after they've had a brain injury? Like genetics, their athletic or sedentary, their age, luck. Anything that's
some of it is probably luck. That's a good question, though. Certainly, someone who has no other comorbidities. So if they're previously healthy, they were physically active, they know their body well, and how it feels to do exercise. In terms of their physical recovery, I think it would be a lot easier to recover if you have that past history of being physically active and healthy. But certainly the severity of the brain injury plays a big role. That being said, though, I know some people are told in acute care that they might never walk again, or their families are told that they might never wake from a coma, and then they end up waking up and making a full recovery. So I think your point about luck might be part of it as well.
Yeah, I think so.
And we talked about insight, and I think that's a big key player, because if you don't have insight into what your impairments are, it can be very difficult to work on improving them, because it's hard to work on something that you don't feel is a problem, right?
Exactly, yeah. Actually, the point about insight leads me to my kind of off-script last question about you, as a physiotherapist at Toronto Rehab, you work with OTs, speech therapists, social workers, rehab therapists, and others. So, in terms of insight, that's very important. They know they have it. People that patients have insight is a big factor for that part to tell all of the therapists or let all the therapists know, and let them know what they need to work on. Really, what's really important, what needs work the most, and how one part the patients know how much their, say, speech therapy impacts their physical therapy, or their OT impacts their social work or whatever. Or do people have insight to that? How important do you think that is, that people understand the relationship between all the therapies?
Yeah, I think that's important. More when you're kind of going into the real world, because in the hospital everything's very structured, and you have your hour of physio where you focus solely on physio.
Yeah.
You have an hour of OT which focuses solely on OT, and so on and so forth. But when you get into the real world, you need to walk and talk and think, and all at the same time. So, and certainly after a brain injury, physical activity can affect your if you've done a lot of physical activity, your thinking can be slower because you're more tired. Or if you've done a hard cognitive session, then you might not have the energy to do a physical session. So certainly understanding just how using your brain in general can affect any area is important. And it's probably important that we work together, OTs and physios and speech therapists, to kind of combine our sessions so that we're not really pinpointing one thing. It's helpful when we work together and we do real life tasks. For instance, I often go grocery shopping with the OTs and their patients. Did you do that?
Yeah.
Yeah, because we want to see how you would do in the real world with shopping and following a list and doing your cooking. But when you go outside, the physiotherapist can watch how you do from a mobility perspective, and the OT watches, if you can find your way and if you can find the groceries. And so we certainly work together a lot, and I think that gives the patient a lot more of a real-life, valuable experience.
Actually, it reminds me, I remember it was at the, when I was there in the medical center in 03, I guess 04 at this point, there's a little apartment they have in there in the hospital that you can stay at one night. That's when I went to grocery shopping the first time with them. Was go to the nearby grocery store and get some supplies I need for the night to see how well I can do one night. This is later on, obviously. This is in 04. This is well after when I was in the outpatient therapy. To see how well I could work a night on my own in the little apartment, sort of. So with them, of course, nearby.
Yeah, we have the same thing. That our inpatients, if they're ready and if it's appropriate, we'll move them into the self-care apartment where they need to cook for themselves, they need to ask for their medications themselves, they need to show up for their therapy on time, and it mimics a more real-life environment instead of the hospital where people are kind of always on you to follow your schedule and bringing you food and bringing you your meds and everything.
Yeah, the time management piece is always just still a big part of what I do well with it, but it's always, it's forefront of my mind is how much time I need to get here, and even if I'm 10 minutes early, at least I'm there. Like, at least I'm not gonna be. I'm always worried about being late, even though I'm always like 10 minutes early. But that's part of my. It's part of my. I guess lingering part of the of the time management piece of brain drinking it back to normal life that's really stuck with me. So
well, in this day and age, being on time is rare, so that's a great quality you have there.
Well, thank you. So actually, thank you so much for this. This talk is actually extremely interesting, and you talked about many things you mentioned are something that really rings true for me in my experience with physiotherapy and exercise and social work and OT and all those other streams as well. So I think this is a great chat, and hopefully other people will find it as enlightening as I have. So thank you so much.
Thank you very much, Nick. Can I ask you a question before we finish?
You can ask as many questions as you want.
Nick, I was wondering if you have any advice for therapists on what we could do to help make the most of a patient's rehab experience. Is there something that you remember that made a big impact on you, something that someone said or did?
Well, I know my physiotherapists. Well, they were all great. Like Wendy and my first physiotherapist was Deb, and then Wendy and Victoria. That was after. But Jen Shears was one of my physiotherapists here, and she has had a huge impact on my life. And she's the one who got me swimming again, and so when I walked into, I was in a wheelchair from my accident on August 1st until end of February, so March 3rd of 04, so for about 6 months, 5 months, 6 months. 6 months in a wheelchair, and by the time I got out of inpatient rehab, I was using a walker. And when I walked into outpatient rehab on the walker, she made sure I was stable and everything, but said, okay, you're not using that again. So she took the walker from me. She's like, when you come here, like use it, leave it here in the vestibule for the outdoors for the the courtroom kind of thing. So leave it here. But when you're in this inpatient for the day for a few hours doing my therapies, you always walk with therapist assistants or me, or by our own, hopefully. So she really challenged me to make sure that I wasn't relying on the walker and shoes. So I think challenging is the big thing. Like, even though I know how she's just an excellent therapist, a great person. But just challenging people to, although it may be tough, because usually you and I've seen a lot of inpatients who have had major physical difficulties and getting around and things like that, but even emotional, psychological difficulties. But challenging them to for you, challenging them can be tough for you too. I'm sure for physical therapists themselves to let a patient not alone. It's never a risk of falling or hurting themselves, but challenging them to really to work on or to do it for themselves. So it's all about challenging. I think, and I really like what you were saying about the finding out what people do. So I think that's important to find out what they like, what activities they've done. So you said like that, meeting your girlfriend at the airport or going grocery shopping, that sort of thing. I'm really rambling here, trying to think of what's really stuck out for me is I think the whole experience was, I mean, as depressing an event as it was and as tough as it was, physiotherapy for me, because I was very active in sports and active, so it was easier for me to get off work. That was maybe happy going to physiotherapy because I could sense myself getting better. Easy way to measure how I was doing, how my balance felt, how I felt physically. So it may be some way to people who aren't physically aware. They're maybe like singers, or not say it's not physically aware, but like people who don't write, or people who don't necessarily, their thing is not that they don't like physical activity as much. They just finding a way for them to really appreciate how well their body awareness and their mindfulness, so that they can get in tune with their own body. So I guess my biggest thing would be finding a way for everyone to get in tune with their body, making people understand. I think my degree in biology, and I went down some anatomy courses, helped me understand when you say like, okay, to raise your right hip, or and feel like you can feel that. Oh, I can feel that. But it was easier for me because I played sports somewhere I knew that you were talking, kind of not knew what you're talking about because I don't have a physical therapy degree, but understand. So get patients understand what moves, why it moves, how their body awareness, I think, is very important for. I would say that's my one piece of advice, is getting people to understand their body awareness.
Yeah, and making that connection even for people who didn't have that, a passion for physical activity before, trying to make it something that they want to do.
Exactly.
Yeah, that's good advice. Thank you.
Well, thank you for this great talk, and I really appreciate it. That's been, like I said, a great chat, and so hopefully we'll actually talk again soon. So, thank you, Kit.
It was a pleasure, Nick. Thanks very much.
Thank you again to Kit for a great discussion. It sounds like very rewarding work. And thank you to another person at Toronto Rehab, Occupational Therapist Jen, who connected me with Kit. And thank you to my friend Carolyn for connecting me with Jen. I want to let everyone know that June is Brain Injury Awareness Month in Canada, so please get out and support your local Brain Injury Association. In Newfoundland Labrador, that is Newfoundland Labrador Brain Injury Association, www.nlbia.ca, or you can go to www.nlbia.ca/loveyourbrainnl. We have taken our lead from loveyourbrain.com, which promotes brain health by encouraging a healthy lifestyle, mindfulness, and body awareness. So please, if you're a studio, yoga studio, or Pilates studio, or another exercise studio, please visit www.nlbia.ca/loveyourbrain to learn more and to register your studio for this. Thank you for listening, everyone. As always, music at the beginning of this podcast is by Ben Sound, www.bensound.com.